What does informed consent for Aripiprazole, otherwise known as Abilify, look like? My name is Dr. Reed Sutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I've been going through a series where each day I go through one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And I've gotten the request for Abilify a few times, so we're going to talk about that today. So Abilify is an atypical antipsychotic. However, it has a novel, although not so novel now, mechanism. Instead of just being a dopamine antagonist, it's actually a partial agonist at the D2 receptor. And so the idea behind this was that hopefully it would help with the positive symptoms of schizophrenia, things like having hallucinations, having delusions, and that it would also help with the negative symptoms of schizophrenia. So things like not taking care of yourself, isolating, not having motivation. I don't know that it's been terribly successful in this goal, but it certainly has produced a medication that has multiple different uses and applications. So the other component is that it also has a lot of serotonin activity. So it's helpful for a lot of mood symptoms in addition to the psychosis. So it's FDA approved for use in schizophrenia, in bipolar disorder, both for mania, mood stabilization, and depression, as well as Tourette's syndrome, major depressive disorder, and behavioral disturbances from autism. It's also used off-label for things like anxiety, borderline personality disorder, PTSD, OCD, drug-induced hyperprolactinemia or sexual side effects, and behavioral disturbances from dementia. So when I talk about side effects from antipsychotics, I break them largely into three categories. So the first are going to be things that can basically happen with any psychotropic medication. So these are things like headache, dizziness, stomach upset, fatigue, drowsiness. And then the second category is going to be the extrapyramidal symptoms. So this is things like tardive dyskinesia, uncontrolled muscle movements, muscle rigidity, dystonia. Now, these are less likely to happen with the atypical antipsychotics. However, I certainly have seen it happen, including with aripiprazole. One of the symptoms that is not necessarily unique to Abilify, but Abilify is one of the worst offenders of, is akathisia. And that's an internal sense of restlessness where maybe you feel like you have to keep moving, you're pacing around, or sometimes it can just be more of a mental internal restlessness, like you're unable to relax, unable to calm your mind. And this can be really debilitating for some. And then the last category of side effects is going to be, of course, the metabolic ones, which is that there's an increased risk of weight gain, of blood sugar issues, of cholesterol issues. And so for that reason, we do have to monitor annual labs, just like all the other atypical antipsychotics. So we want to continue to monitor your comprehensive metabolic panel, your complete blood count, your blood sugar, and your cholesterol at least once a year. Like any antipsychotic, there is the risk of neuroleptic malignant syndrome. This is less likely with the Abilify, just given its mechanism of action, but still a possibility. There's also the risk of SI, and with use in people with dementia, there is the black box warning against atypical antipsychotics that it can increase the risk of mortality. We do have to monitor that complete blood count because sometimes people can have a drop in their white blood cells. And sometimes, even though it's used off-label for OCD, it can also sometimes cause worsening compulsive behaviors. As far as getting off of Abilify, because it has so much serotonergic activity, it acts a lot like an antidepressant. And so the taper and withdrawal principles are going to be similar. If someone's been on this medication for a long time, I'm going to recommend proceeding with a hyperbolic taper. And there certainly is the risk of not only acute withdrawal, but protracted withdrawal as well. And if you want to hear more about that, then check out some of my other videos. So after going through all this, we would talk about whether or not the potential benefits of this medication outweigh the risks for the individual, and we would make a shared decision from there. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for people who are interested in my content so that I can communicate more directly with you, because I may have future offerings, resources, things that I want to be able to share. So if that's you, then send me a DM with your email and I'll add you to the list. And I promise I won't spam you. Wishing you all good mental health, and I'll see you in the next one.